Okay, let's unpack this a bit. Have you ever found yourself maybe nodding along when someone mentions Medicare or Medicaid,
Hmm.
but secretly you're thinking, I wish I really truly got the
It
difference?
happens all the time.
You are definitely not alone there. These are, two huge government health programs in the US, super important for millions.
Absolutely
But
vital.
yeah, often a source of real confusion. So today we're doing a deep dive into Medicare and Medicaid.
Getting into the weeds.
Exactly. Our mission here, pull out the most important bits of info, the key nuggets, so you can quickly get up to speed on, who qualifies, what's covered.
And those crucial 2025 updates.
Yes, what's coming down the pike in 2025. Think of this as your shortcut to understanding these essential programs.
And what's really fascinating, I think, is just how often people use these terms almost interchangeably.
Right.
Yeah, but they serve really different purposes, different groups of people.
Hmm.
We'll break down not just what they are, but maybe more importantly, why knowing the difference actually matters.
Yes.
For you, maybe, or someone you know,
Yeah.
especially when you're making healthcare choices.
Okay, good plan. Let's kick off with Medicare then. This
Or-
is often the one people think of first, right, when we talk about government health coverage. So, what exactly is Medicare and who's it mainly for?
Okay, so Medicare. It's a federal health insurance program run by the federal government
Got it. Federal.
and its main beneficiaries. Typically, people age 65 and older. That's the big group.
The senior population.
Right. But, and this is important, it also covers certain younger folks who have disabilities
Okay.
and people with specific, quite serious medical conditions, like end-stage renal disease, that's ESRD, severe kidney failure.
Needs dialysis or transplant.
Exactly. Or ALS, Lou Gehrig's disease. So it's not just about age 65.
Right. That's a key nuance. Now, lots of people know Medicare has parts, almost like, building blocks.
The alphabet soup?
Yeah. Part A, B, C, D. What do they actually cover? Can we break down those main pillars?
Absolutely. Let's tackle the traditional parts first. Part A, people often call it hospital insurance.
Hospital. Makes sense.
Yeah, it primarily covers your inpatient hospital stays, care in a skilled nursing facility, but not long-term care. That's different.
Oh,
Hospice care and some home health care, too. Think of it as covering the facility-based side of things.
gotcha. Facility care. Then Part B.
Part B is medical insurance. This is
Yeah.
more for your outpatient stuff.
Yeah.
Doctor visits,
Your regular checkups?
yep, regular checkups, preventive services like screenings, vaccines, and other types of home health care as well.
Okay, so A and B are kind of the original core federal pieces.
That's right, foundational Medicare.
But then you hear about Part C and D,
Hmm.
and that's where maybe it gets a little more layered.
It can seem that way. So Part C is Medicare Advantage. This is where private insurance companies get involved.
Ah, the private plans.
Exactly. These are plans offered by private companies, but they have to be approved by Medicare, follow Medicare rules. They essentially bundle Parts A and B together.
So you get everything in one.
Usually, yes. And often, they throw in extra benefits not covered by original Medicare, like maybe some dental, vision, or hearing aid coverage.
Oh, interesting.
The key thing with Advantage plans, though, is they usually operate with networks, HMOs, PPOs.
All right, so you might have to use specific doctors or hospitals?
Correct. That's a big difference from original Medicare, where you can generally go to any doctor that accepts Medicare.
Okay. And Part D. That one sounds straightforward.
Part D is pretty straightforward. It's prescription drug coverage, helps you pay for your medications. You usually get it through a standalone Part D plan or as part of a Medicare Advantage plan that includes drug coverage.
Okay, that clarifies the parts nicely. A, B, C, D, hospital, medical advantage bundle drugs.
You got it.
But these programs aren't static, are they? They change.
Constantly evolving.
And the source material points to some pretty significant updates for Medicare coming in 2025. What should you be aware of? Thinking about premiums, costs, but also maybe new coverage.
Right, there's always that balance, costs and services.
Yeah.
For 2025, yeah, the sources show slight increases are expected for both Part A and Part B premiums.
Okay, slight increases.
Now, for Part A, most people don't pay a premium anyway because they or their spouse paid Medicare taxes while working.
Right, the 10 years of work rule, roughly.
Exactly. But if you do pay a Part A premium because you didn't meet that requirement, you'll likely see a small rise.
Okay. And Part B, that's the one most people pay monthly.
Yes. The standard Part B premium, which applies to most people, is now set at $185 per month for 2025. So a bit of an increase there.
$185. Good number to know. What about the coverage side? Any expansions?
Yes, some positive developments there. Looks like
Aw.
expanded coverage for more mental health services.
That's huge.
It really is. Also, new coverage specifically for cardiovascular risk assessments. And interestingly, certain dental services, but only when they're directly linked to other covered medical conditions, like maybe before heart surgery or something.
So not routine dental, but medically necessary dental.
Precisely. And one other really notable addition, caregiver training is being covered for families dealing with dementia.
Wow, that's really practical support.
It seems like a recognition of the huge role family caregivers play.
Definitely. Okay, so that gives us a good handle on Medicare. Primarily age or disability-based, federal, with these distinct parts and some upcoming changes.
Mhm.
But what about people who don't fit that mold, maybe younger or just don't have much income? That brings us to Medicaid. How is this one fundamentally different? Who does it serve?
Okay, Medicaid. Big shift here. It's fundamentally different because it's a joint program. Federal government and state governments work together.
So not just federal, state level too.
Exactly. And that state involvement is key. Its main purpose, to provide health coverage for people of any age.
Any age.
Okay, who have qualifying low income. That's the central pillar.
Yeah.
Income level.
Got it. Income, not age, primarily.
Right. And it specifically targets groups like pregnant women, children, elderly adults who are also low income, and people with disabilities who meet those income rules. So it's really about financial need.
And because the states are involved, I imagine there's more variation. The source mentions key features that set Medicaid apart. What are those thinking eligibility coverage costs?
You nailed it. Variation is huge with Medicaid. Eligibility is a prime example. It's based on income and family size, yes, but the specific income levels and rules vary significantly from state to state.
So what qualifies you in California might not in Texas.
Exactly right. You absolutely have to check your specific state's rules. It makes giving one-size-fits-all advice really difficult.
Okay, state variability is key. What about coverage? Does it cover different things than Medicare?
It often does. Medicaid typically covers the basics, hospital stays, doctor visits like Medicare. But a crucial difference is long-term care.
Like nursing homes.
Yes, nursing home care, personal care services in the home sometimes. Things that Medicare generally doesn't cover for extended periods. That's a massive area where Medicaid steps in.
That's a really important distinction for older adults or people with chronic conditions.
Huge. And then costs. For people who qualify for Medicaid, the cost is usually very low, often zero.
Little to no cost.
Right. Some states might have very small premiums or tiny co-payments for certain services, but generally it's designed to be highly affordable or free for eligible individuals.
Okay, so joint federal-state, income-based, state-specific rules, broader long-term care coverage, and low cost. That's Medicaid in a nutshell.
That's a pretty good nutshell, yeah.
And just like Medicare, are there things to watch for with Medicaid in 2025, potential changes?
Yes. With Medicaid, because of that joint funding structure, the main thing to watch in 2025 are potential changes at the federal level regarding funding.
Federal budget decisions.
Exactly. Talk of federal funding cuts or reforms can really impact states. If the federal contribution changes, states might have to make adjustments.
Adjustments like?
Well, they might need to change who's eligible, maybe reduce certain optional benefits, or alter how they pay doctors and hospitals. So federal decisions can definitely trickle down and affect state Medicaid programs.
Okay, something to keep an eye on at both federal and state levels then.
Definitely.
So we've looked at them separately. Let's try putting them side by side now, just to really crystallize it. What are the absolute clearest must-grasp distinctions between Medicare and Medicaid?
Okay, the side by side. I think the clearest way to think about it is who they serve and who runs the sheep.
Right.
So eligibility. Medicare is primarily for folks 65 and older, or those with certain disabilities, regardless of their income. Medicaid is for people with low income, regardless of their age. Income versus age disability.
Okay, that's number one.
Who runs it? Medicare. Purely federal government. Medicaid, that's a partnership. Federal and state government.
Federal versus several state. Got it.
What's covered? Medicare covers hospital, medical, some drugs, but extras like dental, vision, long-term care are pretty limited in original Medicare. Medicaid covers hospital, doctor visits too, but crucially, often includes long-term care and potentially more extras depending on the state.
So Medicaid can be broader, especially on long-term care.
Generally, yes. And finally, costs. Medicare usually involves costs for the beneficiary premiums, deductibles, copays, coinsurance. Medicaid typically has very low or no cost for the beneficiary, though again, slight variations by state.
Premiums and cost sharing versus low no cost, that's a very clear breakdown.
Hopefully helps clarify the main lanes they operate in.
It does, but it also brings up a really important question I know people have. Can you actually have both? Is this dual eligibility thing real?
Yes, absolutely real and really important for a lot of people.
How does that work?
So if you meet the criteria for both programs, typically meaning you're 65 or older or have a qualifying disability, and you meet your state's low-income requirements for Medicaid, then yes, you can be enrolled in both Medicare and Medicaid simultaneously.
Dual eligible.
Exactly. And in that situation, there's a clear order of operations for payment. Medicare pays first for services that both programs cover.
Medicare's the primary payer.
Right. Then Medicaid can step in as the secondary payer. It can help cover costs that Medicare doesn't fully cover, like those Medicare deductibles, copays, and coinsurance amounts.
Wow, so it really helps with the out-of-pocket costs associated with Medicare.
It can be a huge financial help. Think about someone on a fixed income with chronic health issues. Those Medicare copays can really add up. Being dual eligible can make healthcare significantly more affordable. It can also cover services Medicare doesn't, like that long-term care piece we mentioned.
That's a critical point for people navigating both systems. Okay, so wrapping this up, what does this all mean for you, the listener? I think the key takeaways from our deep dive seem pretty clear. Medicare. Mainly for seniors and certain folks with disabilities, income isn't the main factor. Medicaid. That's for people with low income. Age isn't the main factor.
Different doors based on different circumstances.
Both programs are absolutely vital for millions, and crucially, you might actually qualify for both.
And connecting that to the bigger picture, it just underscores why staying informed is so important, especially with annual changes like the ones coming in 2025.
Yeah, those premium changes, the coverage shifts.
Exactly. As things evolve, knowing what's happening is really critical for managing your own healthcare journey or maybe helping parents or other loved ones navigate theirs. It's about making informed choices for health and finances.
Understanding these programs really is empowering, isn't it? It gives you more control. And as these systems keep evolving, thinking about 2025, the ongoing money talks, it makes you wonder, what might the long-term impact be on, access and affordability for different groups? And maybe more personally, what role could you play in navigating those changes or even maybe influencing them for yourself or your community? Something to think about.